Difference between antepartum hemorrhage and postpartum hemorrhage. This question has come in February 2024 question paper. Definition: antepartum hemorrhage. It is defined as bleeding from or into the genital tract after the 28 weeks of pregnancy but before the birth of the baby. Postpartum hemorrhage. Definition: any amount of bleeding from or into the genital tract following birth of the baby up to the end of puerperium which adversely affect the general condition of the patient. Incidence: antepartum hemorrhage. 1/3 of the antepartum hemorrhage cases are placenta previa. 80% of the cases are multiparous women. Increased incidence seen in women age above 35 years of age. Postpartum hemorrhage. Incidence 4 to 6% of all deliveries. Causes: antepartum hemorrhage, placental bleeding, unexplained, extraplacental causes like cervical polyp, CA cervix, varicose vein, local trauma. In postpartum hemorrhage, causes are: first, atonic, under that might be grand multipara, overdistension of uterus, malnutrition, anemia, prolonged labor, malformation, and uterine fibroid. Traumatic, under that operative delivery, C-section, episiotomy trauma. Third is retained tissue, and fourth is blood coagulopathy, any blood related disorders. Types: under antepartum hemorrhage, there are two main types, that is placenta previa and abruptio placenta. Under placenta previa, there is low-lying placenta, marginal placenta, incomplete placenta, and complete placenta. Under abruptio placenta, concealed hemorrhage, revealed hemorrhage, and mixed hemorrhage. Under postpartum hemorrhage, types: primary postpartum hemorrhage and secondary postpartum hemorrhage. Signs and symptoms: under antepartum hemorrhage, pain, bleeding, decreased FHR, visible blood loss, malpresentation. And it is depend on the type of antepartum hemorrhage. The signs and symptoms might vary. Under postpartum hemorrhage, if the bleeding is more than 1 liter, then it is major postpartum hemorrhage, and if it is less than 1 liter, then it is minor postpartum hemorrhage. Management: in antepartum hemorrhage, adequate antenatal care, antenatal diagnosis, warning hemorrhage not been ignored, color flow Doppler USG, assess the blood loss, note vital parameters, note degree of anemia, quick and gentle abdominal examination, vaginal examination should be avoided. Under postpartum hemorrhage, management will be antenatal improvement of health status, identify high risk patient, blood grouping will be done, placental localization, prior C-section will be ruled. Women with morbid adherent placenta, during intranatal period, senior obstetrician should be present. Intranatally, third stage of labor to be managed promptly. Oxytocin infusion continued 1 hour after delivery. C-section, 5 international unit oxytocin IV should be given. Exploration of uterovaginal trauma. Difficult labor to be managed well. Observation for 2 hours. Examination of placenta. Replacement of blood and effective homeostasis. Complications under antepartum hemorrhage: maternal, hypovolemic shock, DIC, renal failure, death, and uterine rupture. Under fetal complications, hypoxia, brain damage, stillbirth, anemia, IUGR. Complication under postpartum hemorrhage, injury to the uterus, infection, inversion, subinvolution, thrombophlebitis, and embolism. Thank you.